It's American Heart Month, and we want to share more on the importance of heart health.
Yeah, we are pleased to be joined by Dr. Samuel Hoare. He is a cardiologist with Centennial Heart at TriStar Centennial Medical Center. Dr. Hoare, thank you for being with us.
Thank you for having me.
It kills one of all the deaths in the U.S. 1 in 4 is related to a heart problem, correct?
That is correct. Heart disease remains the #1 cause of death in both men and women in the United States and worldwide.
What do you feel is the biggest obstacle in getting people to take this seriously?
I think especially in light of the current pandemic, I think one of the major problems that we've been seeing is that people are delaying care. Most heart problems have some warning signs, whether that be chest discomfort, shortness of breath, heart racing, lightheadedness, dizziness symptoms. And people, I think, in today's time are delaying seeking care for fear of the virus.
At what point do you have to set that stuff aside and get to see a cardiologist, a heart doctor?
I think immediately. These symptoms, like I said, a lot of them have warning signs. A lot of them, if caught early, can be very treatable. And I think I'd urge patients, if they're listening, that if you have these symptoms, to seek immediate medical attention, either through your current doctor or through the emergency room or an urgent care. But I think the most important part is not to delay.
And do you think you've seen an uptick in the number of cases given the way we live, or is it just truly because you think people aren't taking care of themselves?
Well, I think right now, total number of cases are probably down slightly, and I worry that some of it's due to delay of care because the cases that we are seeing are much more advanced, much more ill than they were previously.
What are the steps we should be taking on a daily basis, Dr. Hoare, that would help lower our risk for having heart disease, assuming it's not hereditary?
That's a great question. I think, if I can make a plug for smoking cessation, that would probably be my first, second, and third thing that people can do. If you're smoking, that raises your risk of not just cancer that we talk about a lot, but also heart disease, stroke. And if you can stop smoking and quit, that's the first, second, and third thing that you should do. If you're not smoking, fantastic, congratulations, but also increasing our activity, so things simple as walking or light exercise daily, weight control, and a heart-healthy diet.
You talked about delaying care. There is concern for people who don't want to unnecessarily go to a doctor's office or hospital. Are there still ways to get your heart-healthy checkup via telemedicine?
There is. There's actually been a great uptick in the way we use telemedicine now. If a patient has a phone with a camera or a computer or even just a landline, we're able to now talk to patients, reach out to patients, do exams over the phone, in a patient's comfort of their own home where they can feel safe. And so we've expanded our telemedicine here at Centennial quite a bit. And I would say at this point, probably a third, if not half of my patients I see on a daily basis are through telemedicine.
Doctor, we appreciate the work you guys do at Centennial Heart, and hopefully folks are encouraged to get a checkup and to take better care of themselves. Thanks for your time today.
Thank you so much.
You're very welcome, and thank you for having me. And just as a plug, the 5th is National Wear Red Day because women's heart health is underappreciated, and I think that we all wear red on Friday to raise awareness for women's heart health as well.
We will join you in that.
Absolutely.